You're still here? You must be really committed to learning something. So let's talk about inferential statistics. Whoa! I know, statistics are typically viewed as the most intimidating topic in research. Session 7 is about the role of chance, particularly p-values. And here I want to make sure you understand what p-values mean, not where they come from. If you want to learn that, take a statistics class. Here we're going to focus on what they mean, and equally important, what they don't mean. Here we go. Consider the following study. Patients who are overweight are exposed either to a new diet or to stay on their same diet. They're the controls. We follow them over time and we count the weight change. And let's say we find the patients exposed to new diet, they lose 4 pounds, while patients on their regular diet lose 2 pounds. We go ahead and calculate the effect size, and we say, on average, patients on new diet lost 2 pounds more than those who did not change their diet. Now, the question I want to address now is, might this difference be observed simply due to chance? Well, let's consider the role of chance. The first thing to know is differences are expected. Two groups almost never have exactly the same mean. And relative risks are almost never exactly 1. One of the fundamental roles of statistics is to determine the probability that an observed difference is due to chance. And that brings me to the p-value. The formal definition is the probability of observing a difference as extreme or more extreme if the null hypothesis is true, namely that the two groups were randomly drawn from the same population. Now, the working definition is the probability the observed difference is due to chance, and that makes statisticians break out in hives. But I can live with it. It's a reasonable way to think about the p-value. P-values are probabilities, and they range from 0 to 1. A high p-value means it is likely the observed difference is due to chance. A low p-value means it is unlikely that the observed difference is due to chance. That brings us to the phrase statistically significant. If the p-value is less than 0.05, less than 5%, our language is the result is statistically significant. If the p-value is greater than or equal to 0.05, our language is there is no significant difference. Now, how do we interpret this? Well, if the p-value is less than 0.05, we reject the null hypothesis. And we say, hey, the observed difference is not due to chance. There must be something real here. But if the p-value is greater than or equal to 0.05, we cannot reject the null hypothesis. And we're left with the observed difference is due to chance. So now you try. Patients in the control group required more cataract surgery than those in the intervention group. 15 versus 8%, p equals 0.01. Is that statistically significant or due to chance? Well, that's statistically significant, right? The p-value is less than 0.05. Patients taking Maxol had a higher risk of developing colonic adenomas than patients in the placebo group. Relative risk 1.4, p equals 0.20. Is that statistically significant or due to chance? Well, that's due to chance, right? The p-value is greater than or equal to 5%. So here are the key points. First, differences among two groups are expected. The p-value is the probability that an observed difference is due to chance if, in fact, the null hypothesis were true. If the p-value is 5% or greater, we say it is due to chance. And if the p-value is less than 5%, we say it is not due to chance. It is a statistically significant difference. All right, time for a couple of more advanced points. Women with breast cancer on a low-fat diet for 5 years develop fewer cases of recurrent breast cancer. 98 versus 124 cases per thousand, p equals 0.03. Well, that's statistically significant, right? The p-value is less than 0.05. Now consider this. Women without breast cancer on a low-fat diet for 5 years develop fewer cases of breast cancer. 20 versus 22 cases per thousand, p equals 0.07. How do we judge that? Well, we say that's due to chance. Well, you should be a little uncomfortable now. By the way, these are both real studies. Do we really think a low-fat diet is good for women with breast cancer, but not for women without breast cancer? That doesn't sound right, does it? And then look at those p-values. They're not that different. 0.03, 0.07, they're pretty close. And that's the point. There's a spectrum, isn't there, from due to chance to statistically significant. And we have drawn a line, and that line historically has been p equals 0.05. Anything above that must be due to chance. Anything below that must be statistically significant. But clearly there's a gray zone, isn't there? I'd say it runs from 0.10 down to 0.01. That's a gray zone. And 0.07 and 0.03 is clearly in the zone. And so that's the advance point. The 5% cutoff is an arbitrary convention. It's an artifact of history. There's no theory, no data to support it. So p-values near 5% should be interpreted cautiously. Now, the second advance point is that large samples make small effects statistically significant. Consider two studies. We'll start with study 1. Patients exposed to drug A, 50% of them recover, while those exposed to drug B, 75% recover. That's a pretty big effect. I think I'd want drug B. But if there are only 20 patients in each group, the p-value will be 0.10. That's not statistically significant. There's no significant difference there. Now consider study 2. Again, 50% of patients taking drug A recover, and 52% of patients taking drug B recover. That's not a very big difference. I'm not sure drug B is any better than drug A. But if there are 10,000 patients in each group, the p-value will be highly statistically significant. P is less than 0.005. So the point here is don't confuse statistical significance with clinical importance. Big samples tend to have statistically significant differences, but that doesn't mean the effect size is clinically important. I want to conclude with a statement from the American Statistical Association in 2016, in case you missed it. I want to read one thing. Their point number 3. Scientific conclusions and business or policy decisions should not be based only on whether a p-value passes a specific threshold. It's good advice, and it comes from the statisticians themselves. So don't let me catch you surfing p-values. Is that me? You want to see me catching the really big wave? Check this out. Whoa, cowabunga! I have one final caution for you. A study with an extremely low p-value can nonetheless be extremely wrong. It may focus on the wrong outcome, it may be confounded by a third variable, or it may confuse statistical significance with clinical importance. We'll get to these questions as we go along. For now, just take the assessment.